Jersey City is partnering with the Clinton Global Initiative to provide city faith-based leaders with tools to combat the addiction and overdose crisis gripping the nation. The city is one of 3 new communities selected for the Overdose Response Network's Empowering Faith Leaders program, in which participants learn about local prevention, treatment, recovery, and harm reduction resources. The partnership will also implement community-based engagement projects to raise awareness about addiction and the overdose crisis. Faith leaders play an important role in turning the tide on the overdose crisis that has reached unprecedented levels in this country, said Megan Affrunti, Senior Director of Substance Use Disorders and Recovery at the Overdose Response Network. Many people turn to their faith leaders during times of crisis for guidance and hope, and when they are prepared to provide effective support, they can save lives. We know that many faith leaders aren't taught how to respond to these issues in seminary, and our program fills this gap by training and mobilizing them to address these issues with evidence-informed and compassionate approaches. According to the State Attorney General's Office, 118 of the state's 1,578 suspected overdose deaths this year occurred in Hudson County, third among the 21 counties in the state. Last year there were 167 suspected overdose deaths in the county, the 7th most in the state. Statistics were Jersey City were not immediately available. Jersey City will assist in the implementation of the program through its Department of Health and Human Services. The Empowering Faith Leaders program will directly engage and train community leaders across Jersey City's diverse range of practiced religions to build the skills and tools to deploy ground-level actions into substance use prevention, treatment, and recovery. Applications to fill the 20 available spots will be available beginning November 2nd. As the most diverse municipality in the state, we want to empower our extensive network of faith leaders who are the critical lifelines and trusted advisors that people turn to for guidance during hardship, such as drug and alcohol addiction, Jersey City Mayor Steve Fulop said. By leveraging our community resources, we are creating an impactful program in partnership with the Clinton Foundation that will help residents live healthier and more productive lives. Beginning in January, leaders from Jersey City's Department of Health and Human Services and CGI will lead a cohort of 20 faith leaders through in-person sessions on a range of topics related to substance use prevention, treatment, and recovery over 6 to 8 months, officials said. Each faith-based organization involved in the program will receive $2,000 in funding from CGI's Overdose Response Network, along with the technical support to plan and execute a community-based engagement project to bring the information and resources back to their community. Faith leaders will receive education and training on a wide range of topics related to addiction, becoming trainers in naloxone administration, learning how to combat stigma and connecting with local service providers. We have more than doubled our services over the past 3 years to meet the skyrocketing demand for mental health and addiction services amid COVID, and this empowerment program is an important next step in our continued progress in building bridges across communities to more directly address our residents' wide range of issues and needs. Added Stacey Flanagan, Director of the Department of Health and Human Services. Chaplains interested in the Empowering Faith Leaders program can reach out to HHS directly by emailing Jessica Garita at jgarita@jcnj.org.